Hello, everyone, and thank you for joining us today. We're here to continue the conversation about the built environment and place-based strategies as a driver of health equity. For those of you who are with us on Tuesday, welcome back. For those of you just joining us, this panel is part of the Building Healthy, Equitable Communities Series, a project from ChangeLab Solutions. The series is a virtual space to explore the elements of a just community and the conditions that will help all children and families thrive. Back in April, we began releasing collaborative episodes which offer training and discussion on how policy plus community power can advance health equity. You can see the full schedule and our 6 episode topics here or on our series homepage. Our kickoff episode explored health equity as a principle and a practice and set a high-level theoretical framework for how to use law and policy to advance health equity. The rest of our episodes lay out strategies for operationalizing this framework. For example, our second episode explored advancing health equity through policies and systems that support working families. And last month, we held our third episode, which looked at advancing health equity through a just food system and equitable procurement. All 3 of these episodes can be viewed on our website, and the link is on our screen there. Today, we're here for episode 4, Building Healthy, Equitable Communities Through Comprehensive Long-Range Planning. And just like the previous episodes, this panel will be posted on our website, so you can come back to listen again in case you miss anything. If you're wondering exactly what an episode is, let's recap. Each episode contains 3 things. First, we publish a blog post which shares the consequences of laws and policies that don't take health equity into account, and how we can respond. In episode 4, we looked at 8 policies that have contributed to place-based health disparities across generations. Then we host a webinar that provides both on-the-ground stories and innovations from community leaders, as well as resources to support your work in healthy change-making. Tuesday's webinar explored how long-range planning can counteract the type of historic issues explored in the blog and create places that support health equity. We were joined on that webinar by Moses Gates from Regional Plan Association to share their experience integrating these concepts into the 4th Regional Plan. Finally, we close each episode by moderating an interactive panel, and that's what we're here for today. Today's amazing panel features diverse expertise in place-based planning and investment. Before introductions, let's touch quickly on format. We source questions for today's conversation from you all through the blog, the webinar, and the panel registration page. We've aggregated these questions and will now pose them to our panel. That being said, if you have questions that arise during the panel, feel free to enter them in the chat box or on your screen, and we'll do our best to try and get to them. So you can put faces to our voices. I'm Erik Calloway. I'm a senior planner at ChangeLab Solutions, where I focus on how place-based policies, systems, and environments affect health equity. My background is in urban design and land use planning consulting. I've been in this for over 15 years and have worked on a range of citywide, downtown, district, and corridor plan documents, as well as a number of streetscape and public space improvement projects. And I'll be moderating today's discussion. With that, I'm going to turn it over to our speakers to introduce themselves and their organizations, and then we'll move into the conversation. So let's start with Andrea, then Kate, and then Stephanie.
Thanks, Erik. Hi, everyone. My name is Andrea Nelson, and I'm honored to be participating today. I am a Senior Community Development Specialist here at the San Francisco Planning Department. And I am part of a 5-person Community Equity and Opportunity team. And we are charged with working within traditionally underrepresented communities that are home to the city's most vulnerable populations. And so we build relationships and trust and bring those community needs back to the department and other city agencies. And our goal is really to address significant issues before they boil up to a crisis situation. And I'm also leading the citywide community stabilization and anti-displacement strategy, which is housed here in the planning department and is an interagency effort. And it seeks to mitigate the impacts of displacement on vulnerable populations.
Thanks, Andrea. My name is Kate Kingery, and I lead the Community Transformation Portfolio at County Health Rankings and Roadmaps. County Health Rankings and Roadmaps is a collaborative program of the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. We provide data, evidence, guidance, and examples to improve local health outcomes and advance equity. This past year, we produced our 9th annual County Health Rankings, which is a data set that shows where we live, work, learn, and play matters to how well and how long we live. We also produced a state-by-state report that looks at health disparities by place and by race and ethnicity. In addition to our rankings data, we have a database of more than 400 evidence-informed strategies, a team of coaches who provide guidance on how to take action, and we administer the Robert Wood Johnson Foundation Culture of Health Prize, which has been awarded to 35 communities across the country for demonstrating a culture of health. And all of our resources can be found at countyhealthrankings.org.
Hello, everybody. Thanks, Kate. My name is Stephanie Garcia-Vause. I'm the Chief Strategy Officer for the City of Henderson. Previously, I had been the Director of Community Development and Services for the City of Henderson for over a decade, where I've been involved in comprehensive planning, regional planning, and a variety of things over the last actually 20 years. In 2016, the City of Henderson was named one of 50 Invest Health cities. And Invest Health is a partnership of the Robert Wood Johnson Foundation and the Reinvestment Fund. Through this program, the City of Henderson developed the Pittman Neighborhood Revitalization Plan, and the plan specifically aims to improve health and outcomes in the Pittman neighborhood, which suffers from being a food desert, having aging infrastructure and housing, having poor connections to nearby amenities and services. And we were able to participate in this program, and I think that's largely why I am here today.
Great, thanks. I hope everybody listening is excited for this conversation as I am. I think this is going to be great. So we had a wide range of sectors represented in Tuesday's webinar audience, and we do again today. So let's start with common questions about multi-sector coordination. What cross-sector partners can be involved in long-range planning for health? And how do you coordinate multi-sector partners who are not necessarily used to working together, or they're not used to looking at what they do slightly differently to be more equitable and forward-thinking? So Stephanie, can you get us started with some insights from Henderson?
Sure. Thanks, Erik. So one of the great things about Invest Health is a program that really required the being put together with disparate teams, like teams that have not typically worked together. And so with the Invest Health project, we had local government represented, healthcare industry, community development, finance organizations, and nonprofits. So we specifically had Dignity Health, who runs our St. Rose Hospital, Southern Nevada Health District, a Clearinghouse CDFI, and 3 Square Food Bank, which provides resources and food service to our community. And Invest Health brought all of us together, and some of us knew each other prior to working on this project, but we were able to really get to know each other and see how each of us was working in this area to improve health, but the different perspectives. And one of the first things that we did was do some asset mapping, to sit around the table to really understand the collective impact that we could make and how our work was really intertwined. So each of us was able to sit down and establish the roles we played, and just through conversation and almost the forced conversation of having to sit down, really gained a better understanding of how we were working together without knowing it, and what opportunities there were for us to work even more collaboratively. So in addition to having that larger steering committee, I would say, we also established a home team who was really comprised of people from different departments: planning, the housing and grants, public works, parks and recreation. We brought in the nonprofit sectors like Habitat for Humanity. We brought in a local university, Toro University, and we also brought in some of the developers who were working in areas adjacent to our neighborhood to establish a dialogue about what was happening, because a lot of people think of the City of Henderson as typically being more affluent and not having needs. But when we took a look at the data, which I know we'll talk about a little bit later, the data showed really different outcomes for community members in 2 different zip codes that really didn't look like the rest of the city.
Great. And so when you say you brought those, those different sectors and organizations in, what did that look like? Was that, generally meetings where all the sectors came together, or was it kind of one-on-one discussions? And what kinds of discussions were helpful in order to kind of get them into the fold? Was that data that you just mentioned something that was helpful in those discussions to kind of illustrate for them how the issues related to their work?
Yes, Erik, that's a really good question. How did it happen? It didn't happen overnight, and as our work progressed, we invited more members to the table and more partners to the table, but typically the best work we had was when we engaged partners in group settings. So we would invite them to regular working meetings, establishing a baseline of understanding. So starting with the data, taking a look at, why do we have increased heart disease in this zip code versus, the rest of our zip codes? Why do we see different health outcomes in these areas in 2 specific zip codes versus the rest of our city? So we started with data, and then we took a look at who is doing work in these areas. And although I would say initially, for example, Touro University wasn't necessarily doing work in these areas, they became an instant partner. They're located in the City of Henderson, and they have opportunities such as a mobile health clinic. And so they became a real great potential partner. But having everyone at the table, we could understand the data, and I know we'll touch on this later. We worked to understand the community needs, and that's how we also recruited more people to the table. And then started having conversations about how, if we're all working towards some of the same goals, how we might be able to help each other. So around the table, and then understanding each individual group or the representative's role and what they played was really important.
Great. That reminds me that what we've seen in a lot of our work in trying to bring multiple sectors together is that it really always starts with just reaching out and having a conversation, and having one-on-one conversation and then leading to group conversation. And in all of those cases, part of the really important things about conversation is that you're talking about the same topics, and you can understand what language you're not sharing, and you understand what language you are sharing, and you can kind of, just the way you have to have those conversations in order to identify how the work in different sectors really relates to each other. Did you run up against any issues with kind of competing community interests or competing interests between the different partners at the table, or did you find that the discussion was compelling enough that generally people felt like they were all headed in the same direction?
In talking to people individually, everyone has their interests, especially, there was a master plan community developer near us, but going back to your point of having those individual conversations, it was really finding the what's in it for me with each of the individual partners that was also beneficial for the whole. And we found more people ready to help give what they could towards the effort in improving health. And once we sat down and talked to them and shared, it really went back to the community outreach, shared what the community was interested in too. But we also found ways for our individual partners to really do what they do best and help move and improve health, but really utilizing each of those partners in their own way.
Great, and that about community outreach is a good lead-in to another really common question that comes up around the process of long-range planning when we're talking about health equity, and that's about how do you authentically and equitably engage communities. So Andrea, maybe you could speak a little bit to this question of kind of competing interests and bringing the community into the conversation. What are some ways that you have, in your experience with the work that you're doing, reached out to populations that are affected by health equity, and what are some ways that you've kind of successfully gotten buy-in from the community around these issues?
Yeah, thanks, Erik. So I have a couple of different examples that are currently happening in the city of San Francisco and also have happened in the past. So I'll start with the Mission Action Plan 2020, which is a plan that's based in our neighborhood, one of our neighborhoods, the Mission, which is, I mentioned our team has, we are based in neighborhoods that are experiencing rapid change and are traditionally vulnerable populations, people of color, low-income communities. And the Mission Action Plan really seeks to retain low to moderate income residents and community-serving businesses within the neighborhood. It's a predominantly Latino population, and more recently it's become a popular neighborhood for residents who have higher income salaries to move into. It's sunny, it's close to the freeway, and there are a lot of private shuttles that take employees from San Francisco down to tech companies that are south of the city. So it's a desirable neighborhood. So it was a new plan for us. It was really community initiated and then became a partnership between the planning department and other city agencies in the community. And it was new in that the planning department has kind of traditionally looked at approving housing development or office development. And this one was really taking a step back and thinking about, okay, well, how can we protect the people who live here now? And there were definitely competing interests, and we specifically call them out in the final plan, which was co-wrote by community members and by the city. A couple of those competing interests, or just competing perspectives, were, for example, a lot of the communities felt that development leads specifically to displacement, and that if we're going to have any housing development in the neighborhood, then it has to be 100% affordable. And the planning department's stance was more on more towards, well, development for housing for all income levels is what we would like to move forward. So it's this constant negotiation and collaboration between us and the mission advocates and community members as we implement the plan. So that was one, and I think why that worked so well is that we had the planning department director at the table at all of the community meetings, which was really unheard of, and set a precedent moving forward for having our higher level senior management talking to community members one-on-one. Another example that I wanted to share with everybody is the Central Market Tenderloin data portal, and it kind of relates to what Stephanie was actually talking about. It's housed within the Department of Public Health here in the city, but was also a partnership with the St. Francis Foundation, which is a foundation started by Dignity Health, and who has a hospital on the border of the Tenderloin neighborhood, which is home to most of our immigrant population. And what we heard from the community members there is that they really wanted access to data. They wanted to understand what was happening in terms of health, what was happening in terms of the demographics of the neighborhood changing. And so we worked with the St. Francis Foundation to develop a data portal. It's online, and it has all sorts of data and health, which I know this group would specifically be interested in. It has resident and health well-being metrics such as off-sale alcohol outlets, healthy food retail, cooking fires, preventable ER visits, and all of this data has really helped the community-based organizations to move their efforts forward, to ask for resources that specifically address the issues that the neighborhoods experiencing. And lastly, I'll finish up really quickly with this last most recent effort that we're doing right now in the city, which is Connect SF, which is a long-range transportation plan that really looks at like 50 years out, transportation in the future. And we hosted focus groups with vulnerable populations that were really focused on like a Chinese-speaking population, Spanish-speaking population, youth, and we paid participants and we provided food for them. And I think that that's another success story in terms of authentically engaging community members.
Great. So You mentioned focus groups, and you mentioned some workshops that the planning director participated in. Can you speak a little bit to kind of, like the format or how those were run? Were they run by the planning department? Or they moderate? What kinds of conversations did you have? Was it generally like standard present and then Q&A, or did you have some kind of focused exercises or discussions that helped to address the kinds of issues that were coming up?
Yes, yeah, good question. So we try not to present, talk too much. We really want to hear from everybody else. And so how we've run workshops in lots of different ways, but we find that kind of the focus conversations at different tables, sometimes issue-based or like topic-based, or we've had open houses that we find really successful. And we always make sure to have, people that can speak the language of the community, so Spanish-speaking staff, Chinese-speaking staff. The focus groups were really facilitated by a third party, which we also find successful. I think, understandably, because of the history of the planning department in the city, there isn't as much trust. And so if we have a outside person come in and facilitate the meetings, then they run very much smoother. And then I would also say that we partner with community-based organizations and go to existing meetings. We want to make sure that we hear from people that don't always have the time to come and can't go to a community meeting at 7 o'clock at night. And we've also had a lot of success with going to farmers markets and kind of doing on-the-ground intercept surveys to catch people in just their everyday lives.
That's great. That you mentioned this idea of trust or lack of trust, and I'm kind of here in the Bay Area, so I'm well aware of this issue of kind of, especially around some particular topics like displacement and gentrification that we'll talk about later. That there's a big issue is the lack of trust of developers or even of the government as it relates to these plans. So you mentioned that having the planning director at these, in these discussions, having a third party run the focus groups were kind of two ways that helped with that a little bit. I think it sounds like maybe consistency of engagement, and that you're looking for multiple ways to be there so that the community feels like, it's not like just dropping in, doing a plan and dropping out, but you're actually there in a lot of venues for discussion. Were there any other things that you can think of that might have addressed the issue of trust and started to break that barrier down that had existed previously?
Yeah, yes, thank you. So I think the last piece that I would definitely mention is our community development team and how we are really embedded in communities and working to build that trust every day and meeting with people, not necessarily about a plan or about a city project, but to really attend existing meetings and just build relationships and understand what's going on in the neighborhood and kind of be the liaison between city agencies and the department and the neighborhood, and that has been incredibly successful. I've noticed that when I'll bring somebody in, for example, to the Tenderloin neighborhood, which is where I do most of my work, that is asking about a public realm design plan, for example, then that the community members are open and much more like at ease, knowing that there's a representative from our team there to kind of like mediate the conversation.
Yeah, that's great. I think that one of the things that I've experienced with planning in general is that it tends to be very project focused, and so one of the things that ends up gumming up projects is that communities want to discuss these issues that aren't really something that you can address with this focused project that you're trying to work on. So that sounds to me like the kind of experience of, okay, look, we've really invested in dialogue with the community independent of specific projects, and that's allowed you to kind of get your hands on some of these topics that might cause a barrier to a project when it comes in. And so now that you've addressed those issues, there's more of a feeling of trust and ability to engage that specific project instead of getting hung up on kind of broader issues.
Yes, that's correct.
So, Stephanie, did you have anything to add about kind of how you consider the populations that are most affected by health equity and long-range planning and kind of the community engagement in the work that you've been doing?
Well, it's great to hear that Andy's best practices up in the Bay Area are sort of similar to what we're doing too. One of the things we started off with doing is we noticed through data that the neighborhood that we wanted to work in was about twice as more Hispanic than the rest of the city. And so we worked with a culturally competent community outreach person who could speak in Spanish and in English, and they went to the neighborhood. We met people where they were at, and she spent about 2 weeks walking through the neighborhood, talking to individuals, all qualitative data, but sort of building that rapport and trust, finding out who those institutions or which institutions in the neighborhood we could also go to and who was most reliable for a resource and who the community leaders were too. And most people pointed to one individual in particular, Ophelia, and this one individual, they said, as soon as you chat with her, she'll get other people on board, she'll bring people. So having the neighborhood tell us who to go to was great. And that person and that contact ended up being great. And we have seen her through the community. But one of the ways that we were able to also build trust is through that community outreach, that led to a community meeting that was held in the neighborhood, and we offered things like daycare, and I think it was face painting and things like that to occupy the kids while the parents were able to participate in a community meeting or do some outreach. And then one of the things that we think we've done to build trust is we listened to the community. So when we initiated our planning process, our steering committee, our local representatives all thought we might go in one direction, but we really heard loud and clear that food and access to food was the #1 priority. Safety and jobs were the top 3 things. They weren't as interested in housing or pedestrian amenities and things that we typically do, but we needed to find a way to address the issue that was most important to them. So what could we do really quickly to help build that trust? We heard the community would like a community garden, and we were able to find partnerships and actually build a community garden. So some of the neighborhood leaders who we'd met through the outreach process were there side by side with volunteers and city representatives, building a community garden. Because food was so important, the city worked with a nonprofit partner, and we were able to secure a grant to bring what we call the veggie buck truck right to the neighborhood, because it is in a food desert. It was hard to get access to anything besides a convenience store that might have an occasional banana or an apple, and then a lot of packaged food. So through this grant opportunity, we now have the Veggie Buck truck who's bringing fresh fruits and vegetables directly to the community, and those are available there. So those types of things, when you can take action and listen to the community and then actually deliver what they asked for, goes a long way in building trust.
That's great. We had a quick question that came in that I think I'd be interested to hear a little bit from Andrea about this in terms of some of these community partners and community allies that we've referenced in doing some of this work with the residents, because I know that San Francisco has kind of an interesting relationship between the government and kind of community organizations. So can you just speak a little bit about what that relationship looks like in terms of, are they contracted workers? Are they, are you consulting with them, and kind of the funding kind of split between government-led activities and kind of community-led activities?
Yeah, that's a great question. I can speak broadly to it. I can't speak specifically, but I'm happy to follow up with whoever that was. But yeah, essentially the city funds a number of community-based organizations that provide services to residents, and a lot of those are actually those contracts are housed within the Mayor's Office of Housing and Community Development, as well as the Mayor's Office of Economic and Workforce Development. The Planning Department doesn't have any funding that we're able to give away, but we did, with the Mission Action Plan 2020 that I talked about, we did help to fund the community organization META, which is the Mission Economic Development Association, to help provide staff for them and time for them to attend meetings, to do research, to help to write the report. And that was always an interesting relationship, and I'm happy to get more into that. But I think that the city is unique in that we have a lot of partnerships with organizations that we do fund that help to do the work that we would like to do, and then there are also community organizations that we do not fund, that we are working to build their capacity without providing resources. Does that?
Yeah, great. Yeah. So from a little bit of a different perspective, the issues that kind of the way these issues play out are going to feel different in different kinds of urban contexts, more urban, less urban, smaller town, rural settings. Kate, can you maybe speak a little bit, if you have thoughts on kind of what planning for health equity looks like a little bit differently in lower density settings or small town or rural settings?
Thanks, Erik. Equity is something that we do think about relative to place, and similar to the examples that Stephanie and Andrea gave around, there are different ways that we think about equity, and so that is using local data to understand what are the demographics in your community, no matter where you are, and really understanding where the health disparities are among groups in your community, as well as the engagement strategies. So making sure that you're really thinking about those groups experiencing health inequities and engaging them in your community outreach and understanding perspectives of those residents. Place can also have also play a factor in how you design those outreach strategies. And so similarly, childcare is an issue. Transportation may become more of an issue. Access to broadband, or understanding where are those anchor institutions in communities, in rural communities or smaller cities. That may have a different dimension, but it is still about the engagement component. And engagement not only to really understand what the challenges are, but to identify where the strengths, assets, and social connections are in the context of the community. And another way that we think about equity relative to place is by focusing on a broad view of what equity means and how that's reflective of the economic and social conditions within a community, and is inclusive of race and ethnicity, economic status and income, gender identity, orientation, ability, and other factors. And so it really is about the context of the community based on local data and where the needs are and understanding the perspectives of residents. That's how we see some of the distinctions based on place.
Great, thanks. And I think that one of the things that is related to what data can identify and related to what you find out when you talk to the community and just generally assessing the community, with all of this work, I think so much of it is based on just really understanding what the local context is. So for the case of low density, small town or rural settings, rural and small town in particular, I think it becomes just more important to kind of really focus on asset area, like specific places, because every community has some place which is like, this is the heart of the community, or this is where the most interactions happen, or where the most activity is concentrated, and so that's going to allow you to touch a larger number of people because they're more concentrated there. They're doing more things in that place than they are in the community more broadly, and so that maybe is one strategy for being a little bit more efficient with strapped resources or trying to deal with lower density areas. To wrap this topic up really quickly, we have gotten some questions about how youth can be involved as integral allies in the planning process. If you're interested in that, I suggest you check out a resource that was co-designed by youth at every phase, from research through design, called Pathways to Policy, a step-by-step playbook for young people who want to change the world. So that, just to throw out a resource that you can go and check out if you're interested in that. And I think Andrea had another thing to add to that topic.
Yeah, thanks, Erik. I would also direct everyone to look at Y Plan online. They're a great resource and also have a really fantastic model about working with schools and teachers to develop curriculum around what's happening within the youth community.
Great. And that was Y Plan, like the letter Y, plan?
Yes. Yes.
Great. So we've heard data come up a bunch of times now, and so that's something that comes up a lot, both in terms of conversation about equity and in terms of questions that come up about how to do planning and equity, health data, evidence, and indicators. So Kate, can you build on that a little bit and speak to kind of where our listeners might go for data as a jumping off point, and speak a little bit to what the evidence is out there for place-based strategies to improve and reduce health disparities?
Sure, Erik. So I have a couple of examples of platforms that are out there that share data related to health, but there are some similarities between these platforms, and that is they each contain a model or a framework that offers a broad definition of health. They serve as a starting point, both in terms of providing data, but also as a starting point for exploring local data that is context or community specific, as well as a place to look at disaggregating local data to understand disparities. One example certainly is county health rankings and roadmaps. And so we have a model that's based on 4 factors that drive health and their health behaviors: clinical care, social and economic factors, and the physical environment. And within each of these factors then, we have a comprehensive set of 33 measures that we look at and provide a data set for nearly every county across the country annually. Similarly, City Health Dashboard, which is at cityhealthdashboard.com, they use the same 4 factors as county health rankings and roadmaps, and they provide some additional measures that are specific to cities, and they provide this data for more than 500 cities across the country. And the third one that I wanted to mention is the City Health Initiative, and this is funded by the de Beaumont Foundation, and they're focused on the 40 largest cities across the country, and they've identified 9 policies that they think go into creating a culture of health, and they have they've lifted up exemplar cities reflective of those 9 policies. And I'll talk a little bit more about examples from the Culture of Health Prize as well. But what we do at County Health Rankings and Roadmaps with the model that we have for the data that we provide is we link all of our measures to the evidence. So communities have an idea of what it is they could do from an evidence-informed perspective to take action in their communities to address these measures. And I wanted to provide a couple of examples of, from the evidence base that supports specific place-based strategies. So for example, zoning regulations for land use is scientifically supported with the evidence to contribute to health improvement. Mixed-use development is another one that's scientifically supported. There's a great example that the King County Housing Authority developed outside of Seattle in Greenbridge, Washington, which is a multicultural mixed-use development, and an example of how they've combined their approach to planning and evidence-informed strategy with a focus on increasing equity in their community. Inclusionary zoning is a third strategy, which is about inclusion of affordable housing units in development. And this one is scientific. That there is some indication that it helps improve socioeconomic diversity, and it also has an evidence rating attached to it as well. But similarly, while these are about land use and capital developments, there are a number of other scientifically supported strategies that we believe that are place-based, go to the built environment and contribute to health and communities. And these involve public transit, and these are all scientifically supported. These are public transit systems, complete streets and streetscape design, safe routes to school, case-managed care for community dwelling frail elders, telemedicine, paid family leave, universal pre-K, transitional jobs, and culturally adapted healthcare, as well as community policing and drug courts. So you can see there is a plethora of examples out there of the strategies that have evidence. But I also wanted to talk about our What Works for Health database of evidence-informed strategies does contain a disparity rating where we rate the likelihood of these strategies contributing to reducing disparities in communities. But we recognize that's only half the equation. The other half of the equation then is in the implementation of these strategies in communities and the recognition that this is an opportunity to continue to focus on an equity lens or bring an equity lens to the implementation process to understand what the effect you're trying to have with these strategies, the populations you're targeting, the cultural context, and the kinds of outcomes you're looking for.
Great, thank you. So, we've heard a number of times that, data was used to help us identify this neighborhood, or data was used to help get partners on board, or we use data to figure out what approach to take or what the problems we're experiencing are. And so I think a lot of communities are struggling, or they just ask the question like, okay, what's the data that we have available to start with? And that's just, we have at this point what we've gathered that we can pull together from different places. But moving forward, obviously, it's clear that the more data that we can have on these issues, the better. So do you have any thoughts on how we can, how do we measure success in terms of trying to achieve health equity, or how do we measure things moving forward in terms of tracking plan implementation in ways that will help grow the data base that we have in order to make this easier or more effective moving forward?
Sure. Certainly, we start with the place of focusing on a broad definition of health and the various factors that contribute to health. And then, of course, knowing your region's baseline data. Starting from that place of understanding where it is you're at currently, to then identify what are those key performance indicators and the strategies that you're looking to implement to improve opportunities in your community or your region. Also then monitoring your population-level health outcomes. And so the importance of having an understanding of your data sources at a population level that you're beginning with for your baseline, that you identify through your ongoing monitoring and tracking, and then important to know the demographic shifts in your community over time and how different populations in your community are being affected by the strategies that you're implementing or the plans that are being developed. I think there are a lot of benefits to tracking implementation, but that go to some of the things that we've talked about, and that is understanding the impact of regional growth on populations and better understanding who is benefiting and who is not, as well as engagement of residents, building public will, and finding multi-sector partners who are willing to work together. So there is a community that has won the Culture of Health Prize, the Robert Wood Johnson Foundation Culture of Health Prize, and that's Kansas City, Missouri. And one of the things that they have instituted is KC Stat. And so it's their performance dashboard that is focused around a broad definition of health. And they've been using it for a few years. And their key performance indicators relate to housing quality and affordability, healthy neighborhoods, transportation and infrastructure, planning, zoning, economic development, and public safety. And one of the things that they've been able to do as a result of this dashboard and the transparency that they have around their outcomes and their measures is that they continuously get a high response to their resident surveys that they then use to inform their planning efforts at the city level.
That's great. And you mentioned the kind of using it to target populations, and I think one thing that I wanted to mention about that is when we're talking about place, and you're talking about who is benefiting and who is not, right? When we talk about place, in any particular community, who's benefiting and who is not, you'll experience between different neighborhoods within the same city, within the same town, and neighborhoods that are right next to each other. So one of the things that I think the field in general is getting better at and working towards, but I just want to emphasize, is the importance of having that data at a level that you can distinguish between different neighborhoods is really important. And I think that you'll find that some of the, the more innovative and communities that are further along in this, they have data portals or they're gathering data that's being really helpful for their decision-making processes and for their strategies. You'll see that the data that they have is at that level where you can distinguish between neighborhoods. So the CDC 500 Cities project does it at the census tract level. Some other cities like Denver, Fresno, and Baltimore that have various types of health or other data portals have data at that level. So I think, I don't know, I haven't seen the Kansas City one, if it's data at that level as well, but I think that's one of the places where moving forward communities should try to focus on helping build the database at that scale.
And that's great, Erik. I would just add, we really appreciate that those resources are out there to be able to get to a zip code level or a census tract neighborhood level. We also recognize for rural communities and those smaller population centers that we still have county-level data available, and there are some counties that don't have enough of a population yet for us to rank them.
Yeah, that's interesting.
So we have quite a bit of data available that can accommodate different size places.
Great. So I wanted to move on, talk about another topic that is a really important problem that is experienced in a lot of communities and comes up very often when talking about equity and planning for health equity, and that's gentrification and displacement. It's very common for it to feel like any improvements that a community pursues, like zoning or open space and street improvements, just development, that those improvements are followed by gentrification and displacement. And this can be the case even when there are, a lot of affordable housing requirements in place. So, Andrea, maybe how are you understanding how and where gentrification and displacement is happening, and maybe some strategies that the city has taken or is planning on taking aimed at avoiding that outcome? Like how can we try to achieve this goal of having safe and healthy neighborhoods for low-income families?
Mm-hmm. Yeah, I feel like this is $1 million question. Okay, thanks, Erik. So yeah, in terms of your first question, we're working with the Urban Displacement Project, which is housed in UC Berkeley, and they have mapped the Bay Area and a couple of other cities. I think Boston's one of them, and looked at a bunch of different metrics and used a methodology in order to come up with like an analysis of what neighborhoods are going through different stages of displacement and gentrification. And I think I want to take a step back and just define how we define displacement and gentrification, because I feel like they're often combined into one word or one phrase, and I think they are distinct. So when we say residential displacement, we say that it occurs when a household is forced to move from its residence or prevented from moving into a neighborhood that was previously accessible to them. And then when we say gentrification, we generally define it as the transformation of a working class residential or commercial use. And so we come from the perspective of that gentrification is happening in the city, and it can happen without displacement. And so we're working to stabilize communities and prevent displacement where gentrification is happening, but also where gentrification is not happening, because I think they don't necessarily always go hand in hand. And so part of that effort is part of my work right now, which is the Community Stabilization and Anti-Displacement Strategy. And we're looking at all the city programs and policies that are being implemented right now in order to stabilize communities. We're assessing them, and then we're also taking big ideas, inspiration, in order to think about what else the city could do in the future to advance, and address this ongoing housing crisis and affordability crisis that we have right now. I think I also want to talk about, get to your question about capital projects and infrastructure, and how do we support vulnerable populations and low-income neighborhoods without initiating displacement. And I think we have two examples in this city that I would like to highlight. One is the Western Addition Community-Based Transportation Plan, which was managed by SFMTA, which is the Metropolitan Transportation Authority. And basically the Western Addition is traditionally African American population, low income, and also was unfortunately significantly impacted by redevelopment and urban renewal. And so what SFMTA did is they went into the community and they really asked people, well, what is a transportation enhancement plan look like to you? And the neighborhood said, contrary to what you all want to do at SFMTA, we don't necessarily want bike lanes or bikeways, and we want more safety for pedestrians, slow down the cars, put in more crosswalks. And so SFMTA responded to what they actually heard from the community, instead of coming in with an existing plan about how to improve transportation in the neighborhood. I think another great example is our Recreation and Park Department went through a process to come up with equity metrics, and they specifically looked at health-related metrics that included age, asthma, low birth weight, low education, and they then mapped the city to come up with the equity zones. And they evaluated their capital investments in the past, but also in the future, based on where the equity zones are in the city, and they are prioritizing projects within the neighborhoods that really would benefit from improved recreation and parks.
Yeah, I think that's a really great approach. And with this work that you're doing on the housing policies, is there a resource that's available that kind of shows, regardless of how far you are in evaluating the success of the policies, that kind of goes through the range of policies that are in place? Because I know that San Francisco is a place that has tried a lot of things.
Yes, that's a great question. It is not online, but I'm happy to share it with anyone who would be interested in seeing that, because it is, a list of 60 different policies and programs.
For those
happy to. Yep. Yes, exactly, and also happy to share, some of the things that we're considering, like a first right of refusal, which is basically offering the sale of a housing, of a multi-unit housing building to the people who are living there, the renters that are living there, or community organizations, before it goes to the market.
Interesting. So I think we have time for one more to squeeze in. Got a question here. Kate, do you have any recommendations about collecting and analyzing data in areas that are too sparsely populated for neighborhood level analysis?
Thanks, Erik. Well, and to my point earlier, we have a number of geographies across the United States, or population bases across the United States. And so certainly county health rankings and roadmaps and the data that we have available is one way for identifying data within smaller geographic areas. And I'd be happy to do a follow-up with the person who asked that question and connect them with our data team about some other resources that we would have available.
Great. Thank you very much, Andrea, Kate, and Stephanie. We're really grateful that you're able to participate and share your knowledge and experience with us all. We're excited to announce that Episode 5 will be launching in September. It will explore advancing health equity through transforming the school climate. To learn more about healthy long-range planning, you can check out our Healthy Comprehensive Plan Assessment tool, where you can evaluate how well your current plan might be addressing health. To dig deeper into specific elements of healthy places, visit our Healthy Housing Toolkit, our Complete Parks Guide, or our Guide to Building Healthy Streets. For guidance on community engagement or multi-sector collaboration, see the Changemakers Guide or Health in All Policies resources. And last, stay tuned for the Blueprint for Collective Action, which is a guide that we'll be releasing at the end of this series that focuses on how communities can address health inequities. And if you don't happen to see what you're looking for, please feel free to reach out to us for technical assistance. We may be able to help. For those who had a question where someone said, oh, I can follow up with that and you're interested, please follow up with us and let us know, and we can forward that information on to you. So feel free to get in touch and share your questions or comments with us. As soon as this panel ends, you'll be redirected to a very quick follow-up survey. So please take 2 or 3 minutes to share your feedback with us and help shape this conversation and help shape our events in the future. And a reminder, the recording for the panel will be available soon, and you'll receive a follow-up email about that. So thank you so much, everyone, for joining us, and have a good day.